Parrot. High blood pressure is one of the leading causes of death worldwide. In fact, according to the World Health Organization, WHO, globally, about 1 in 6 adults has high blood pressure. Also, they estimate that high blood pressure is responsible for almost half of all strokes and heart attacks. Yet, despite all this, it's estimated that only 1 in 4 people at risk actually get their blood pressure under control. So, today, let's learn all about blood pressure, how to measure it, why it's so dangerous, who is at risk, and most importantly, what you can do to keep your blood pressure under control. Blood pressure is simply the force of blood pushing against the walls of your arteries, those vessels that carry oxygen-rich blood away from your heart to the rest of your body. Now, blood pressure is measured using a device called a sphygmomanometer, and it's expressed using 2 numbers. The top number is called the systolic blood pressure. This is the pressure inside your arteries when your heart beats and pumps out blood. The bottom number is called the diastolic blood pressure. This is the pressure inside your arteries when your heart is at rest between beats. A normal blood pressure reading is considered to be less than 120 over 80 millimeters of mercury, mmHg. For reference, anything between 120 and 130 over 80 and up to 90 is considered pre-hypertension, and anything 140 over 90 or higher is considered hypertension or high blood pressure. Now that we have covered what blood pressure is, let's move on and talk about why is blood pressure dangerous. Well, when your blood pressure stays high over time, it can start to damage the walls of your arteries. And this damage makes your arteries more likely to become clogged with plaque. Plaque is made up of fat, cholesterol, calcium, and other substances in the blood. Over time, plaque can completely block some of your arteries, which can cause a heart attack or a stroke. High blood pressure can also damage the arteries that supply blood to your kidneys, which can lead to kidney failure. And finally, high blood pressure can damage the small blood vessels in your eyes, which can lead to vision loss. That's why it's important to have your blood pressure checked regularly, especially if you have risk factors for high blood pressure. Risk factors include eating too much salt or processed foods, not exercising regularly, smoking or drinking too much alcohol, having high stress, or if high blood pressure runs in your family. Now, you may be wondering, okay, doc, what does it mean if my blood pressure is consistently high? Well, it means that you have hypertension, or another term for it is chronic hypertension. And if left untreated, it can lead to serious health problems such as heart disease, stroke, and kidney disease. Hypertension can often be controlled by making changes to your lifestyle. These include eating a healthy diet, exercising regularly, maintaining a healthy weight, avoiding smoking, and limiting alcohol intake. However, sometimes medication is also necessary to help manage blood pressure in addition to these lifestyle changes. But I will go more in depth about treatment in just a minute. First, let's talk about how you can prevent high blood pressure in the first place. As I mentioned earlier, there are several things you can do to lower your risk of developing high blood pressure. One of the most important things you can do is eat a healthy diet. A healthy diet for blood pressure includes eating plenty of fruits, vegetables, and whole grains, as well as lean proteins and low-fat dairy products. Fruits, vegetables, and whole grains are packed with essential nutrients that can help keep your blood pressure under control. Lean proteins and low-fat dairy products are also important because they provide calcium and vitamin D, both of which are important for maintaining healthy blood pressure levels. Another way to reduce your risk of high blood pressure is to exercise regularly. The American Heart Association recommends that adults get at least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity aerobic activity a week. Exercise can help strengthen your heart and improve your overall health, both of which can help keep your blood pressure under control. Finally, don't forget to stay hydrated because dehydration has been linked to high blood pressure. So, the key to preventing high blood pressure is to make gradual changes to your diet and lifestyle. These changes don't have to be drastic, but they should be sustainable over time. By making these changes, you can help lower your risk of developing high blood pressure and maintain healthy blood pressure levels for years to come. Now, let's talk about what you should do if you think you might have high blood pressure. If you suspect you may have high blood pressure, it's important to see your doctor as soon as possible. Your doctor will measure your blood pressure and review your symptoms and medical history. They may also perform other tests to rule out other conditions that could be causing your symptoms. If you do have high blood pressure, your doctor will work with you to develop a treatment plan that may include lifestyle changes or medication. Next, let's talk about when you should seek immediate medical attention for high blood pressure. Severe headache, shortness of breath, nosebleeds, palpitations or a rapid heartbeat, nausea, vomiting or diarrhea, vision changes, chest pain or pressure, or swelling in your legs, ankles or feet. All of these could be signs of a more serious condition that requires urgent treatment. Finally, let's discuss how to live with hypertension once you've been diagnosed. Living with hypertension doesn't have to be overwhelming. With the right mindset and approach, you can take control of your condition and live a full, healthy life. First, it's important to understand your diagnosis and the steps you need to take to manage your blood pressure effectively. This includes understanding the importance of making lifestyle changes, such as eating a healthy diet, exercising regularly, and avoiding tobacco and excessive alcohol consumption. Next, make sure to take your medication as prescribed by your doctor. Don't skip doses or stop taking your medication without consulting your doctor. And remember to monitor your blood pressure regularly at home. This will help you and your doctor track your progress and make any necessary adjustments to your treatment plan. Okay, so let's go through a quick summary of everything we have learned today. Blood pressure is a measurement of how hard your blood is pushing against the walls of your arteries. High blood pressure, also known as hypertension, can damage your arteries and organs over time, increasing your risk of heart disease, stroke, and kidney disease. Fortunately, high blood pressure can often be controlled by making changes to your lifestyle, such as eating a healthy diet, exercising regularly, and avoiding tobacco and excessive alcohol consumption. If you have high blood pressure, it's important to see your doctor for regular checkups and follow their treatment plan. With the right mindset and approach, you can manage your blood pressure and live a full, healthy life. Thank you so much for watching. If you enjoyed this video, please do me a favor and click that like button.